Hello, this is Iran Kemp, and this will be a presentation on the treatment evaluation of reactive attachment disorder, or RAD as it will be referred to in this presentation. So now what is RAD? Well, according to the DSM-5, it is when children display inhibited, emotionally withdrawn behavior toward an adult caregiver, which tends to lead to persistent social and emotional disturbances, typically stemming from gross neglect and deprivation. And as a result of that, the children tend to display unexplained irritability, sadness, or fearfulness. Now, contrasting this with a secure attachment, the baby will tend to have a need, the baby will cry, and then the needs will be met by the caregiver, and therefore trust develops. But however, looking at this in the context of RAD, the child does not have a chance to develop a healthy attachment cycle. So the baby will have a need, the baby will cry, and the needs are not met by the caregiver. Therefore, trust does not develop. And so, one way of treating RAD, we can look at this in the context of behavior therapy. Specifically, you're looking at the individual's outward and observable behavior, and you're looking to try to change that. One way of doing that is using behavior management training, which is typically geared toward the caregivers to try to teach new training techniques or caregiving techniques on how to discipline the child. And so, in the context of BMT and RAD, you're trying to tackle the behavioral issues. And what's said through basically about behavior management training is that the issues tend to stem from the neglect and the trauma, but it manifests itself in behavioral issues. So, if we can tackle the behavioral issues, we can also maybe combat what's going on inside of the child. So now there was a case study done by Buckner and colleagues, and they were using BMT to treat RAD in a 7-year-old girl who was living with her grandparents. And what they found was that as they taught the grandparents these different techniques on how to handle her behavior, there was a decrease in her problematic behaviors and an increase in compliance with her caregivers and her teachers' commands. And so she actually delighted in spending more time with her caregivers and following their orders. But there are some limits to this. This was a single case study, and there is a need for the use of randomized clinical trials in the context of BMT and RAD. So, another form of therapy that can be used for RAD would be pharmacotherapy. This is looking at the physiological basis for psychosocial processes and events. In the context now of this type of physiological issues and RAD, what happens is there's a physiological stress, something like the trauma that the child goes through, which increases cortisol production and inefficiencies in serotonin and growth hormone releasing systems. So, in other words, the child's whole chemistry kind of gets thrown out of whack. And so, a type of therapy, a type of pharmacotherapy that can be used for this is selective serotonin reuptake inhibitor therapy, which is just the use of a drug. Typically, these are antidepressants. And what this is looking at specifically is the relational trauma that these children deal with, and how to tackle that with the medication, basically to reduce the brain functioning deficits. And so, looking at this image here, we have a contrast between a healthy brain and an abused brain. Looking at these certain areas of the frontal lobe where we see a lot of activation, or a lot of pretty much activation in the areas that have to do with emotional regulation. But now in this abused brain, we see that there's pretty much no activation here at all. And this is actually a PET scan from a Romanian orphan who was institutionalized shortly after birth. So this child could have possibly had RAD, and what we're looking at is what happens in the brain physiologically. And so, this case study in particular, sertraline was used to treat RAD. This was the SSRI drug used. And this study was done by Weinberg. And it was two case studies here. Case study one was a 12-year-old girl. She was diagnosed from birth to 5 years of age with RAD, ODD, and learning disorder. And what they found was as they increased the dosage of sertraline to 100 milligrams daily, there was an interest in social activities with her parents and siblings. There was increased mood and behavior. The researchers, though, they were particularly interested in the social activities. This child was actually wanting to engage in social activities with her parents, which was something that she had never done before, which is what this case study mentions. And then in case study two, we have a 6-year-old boy. Again, when he was very young, he was diagnosed with RAD, ODD, and mood disorder. And his dosage of sertraline increased as well. It went up to 150 milligrams daily for him. And what they found was that he had an interest in social activities with his parents and his family, and he was spontaneously seeking their affection, which was something that he did not do before. He was totally withdrawn from his parents. He never sought their affection at all, or any other caregiver's affection as well. And so they found interesting results here that they weren't necessarily thinking that they were going to find. Of course, using sertraline, they knew, okay, maybe there'll be an increased mood or behavior in these children. But what they found was that the issues stemming from their RAD was actually decreasing as well. But now, this also has some limitations, some big limitations, really. And one of them is that it's unlikely that the drug therapy worked alone. It could have been that the parents were actually beginning to treat their children a little differently. That's something that could have been working as well. And again, we were dealing with children here. We were giving children, drugs in this study. So that's very controversial. These children are below the pubertal age and can cause a lot of issues with the brain development, can actually hinder their brain development. So it's always good to move forward with caution when using drugs on children. And also here we're unable to generalize these effects because this is only a case study with 2 children. So there's not much that you can generalize across the population of the rest of the children with RAD. And another form of therapy that we could use for this would be family systems therapy. So in family systems therapy, we're trying to understand family dynamics. Tends to be that parents hold a lot of power since children are first exposed to their parents. So parents have a lot of influence over typical and atypical development in their children. And what can be used specifically in family systems therapy would be attachment therapy, which looks at improving the child's trust, which has not been developed, improving their social and emotional functioning, and teaching effective parenting techniques. This is often looked at, especially in this following study, in the context of foster care children or orphans. So looking at this study, it was a one-group pre-test, post-test design done by Wimmer and colleagues, and they were specifically looking at attachment therapy to treat RAD among children in the foster care system. So one thing with RAD, according to the DSM-5, is that a lot of children in the foster care system tend to be diagnosed with RAD. And so they used attachment therapy. They were using it in a family-focused counseling kind of way. And what they found was that the children were less impaired. So they were less impaired so far as their RAD. And specifically, when it came to the Randolph Attachment Disorder Questionnaire, they found that the impaired range of scores went from impaired to subclinical. And then when it came to the Child and Adolescent Functional Assessment Scale, it went from the impaired range to moderate with a decrease of 30 points. So pretty good significance found in this study. But of course, there's limitations with everything. There was very weak validity. This test was very limited in its scope, and it needs a stronger study because this was just a one-group pre-test, post-test. So those tend to be kind of weak in and of themselves in certain situations. But now, let's just kind of turn our attention over to a form of biblical therapy. So what we find in Psalm 127:3 is that it says, "Behold, children are a heritage from the Lord. The fruit of the womb is a reward." And in 1 Timothy 5:8 we are told, "But if anyone does not provide for his own, and especially for those of his household, he has denied the faith and is worse than an unbeliever." So what can be used here is the basic foundation of children being a gift from God. And if parents understand that, or caregivers in general understand that, they can modify the way in which they react and respond to their children, increasing healthy and secure attachments. So, this is something that maybe a Christian counselor can use as a foundation in parent child interaction therapy, using this as the basic principle that is guiding that parent child interaction. Knowing that, okay, this child is a gift from the Lord, and I am to cherish this child, and I am to respect this child, nurture and care for this child, just as Christ nurtures and cares for us. So, with the scope of all of these different therapies that we've looked at in the context of RAD, uh, it could be said that any one therapy in and of itself is maybe not the most effective, but maybe a combination of these things because RAD is something, as we've seen here, that tends to stay with an individual if it's not tackled. And that will be the conclusion of this presentation today. I hope you found this information informative and helpful. Thank you.